want to rule in and rule out problems. That's our job. This is what I do with my patients. This is what I do when I'm teaching other therapists. When we're talking about shoulders, right, there's a few things that we want to consider in terms of structure. We have bones, we have ligaments, and then we have tendons, right? Bone and bone together make a joint. This is our shoulder joint. It's made up of 3 bones, actually. It's your collarbone, your clavicle, your humerus, and your scapula. All 3 of them together create this joint that we have that allows us to do all this movement, right? It's held together by ligaments. Ligaments are connective tissue, and they just hold the bone together to give us stability, right? And then tendons, most of the time in the shoulders, we are hearing a lot about rotator cuff muscles. There's 4 of them, and together they pull the head into the socket. That's how they work. They pull it into the socket, and they give us what is called dynamic stability. It pulls it into the socket, and it allows us to move in a pain-free range. After the age of 40, right, we have what's called wear and tear, and there's increased risk of tendon types of issues. Does that make sense? Now, I already know if you didn't fall, you most likely didn't, you don't have a break, you don't have to worry about anything. The difference between therapy and working out is therapy is supposed to find your problem. So I think that a lot of people have a misconception of therapy because what we do looks like working out. If you could just work out, you'd go to a personal trainer. You can go to the gym, right? As therapists, one of the things that we need to do is find out where the root cause of the problem. So it's not just about exercise, but it's about location. Where are we exercising? In what direction are we exercising in? So, to a certain extent, our exercises or our therapy should be what we would call dosed out, right? Like when you take your medication, aren't you given a certain amount of dosage to make sure that it's effective and that it works, right? So, exercise isn't just about exercise, it's about in what direction, where am I exercising, so that, and then how often am I exercising so that I can know that there's some results.